Welcome back to my channel. My name is Brett. I'm a physical therapist. And if you're having any ankle pain or stiffness in your ankles, then this video is for you. I want to go over the 3 things that I do to keep my ankles mobile and strong. A lot of runners develop stiff ankles or pain in their ankles because kind of a defense type mechanism, because you're running, your ankles want to stabilize and keep everything stable and secure. The only issue that can arise from that is if you don't have enough strength or enough mobility, you can develop some pains in the ankle or up in the knee, as the knee may need to compensate for that lack of motion or lack of strength all the way up to the hip. So some issues can arise going up the chain, so it's really important to look at the ankles. I'm going to show you guys the 3 things that I do that won't take you any more than a couple minutes. First, I like to do a mobilization of my ankle. So most runners are stiff into what's called dorsiflexion, or the ankle, the foot coming up towards the knee. This is a mobilization with movement. So I'm pushing this band down onto what's called the talus, the bone on the top of the foot, and I'm pushing down on that to get that to glide posteriorly. That's going to help to increase my dorsiflexion, as well as I'm pushing through my toes. I'm trying to activate the plantar flexors to kind of get more of a stretch and kind of get activation of the foot. So I'll do a few of these, maybe about 10 reps, 2 times 10, and you can do these up to once or twice a day. Next, I'm going to go into a little bit more of a stabilization of supination and pronation. So when we go through running, or even walking, supination and pronation are necessary components. So when you're pronating, your foot is adapting to the ground, and you want to be able to really, you want to have a good amount of pronation. You want to be able to control that motion. So you want to have that mobility of pronation as well as supination. So supination is after you feel the ground, you pronate, you feel the ground, and then your foot becomes what's called a rigid lever. It supinates and then it pushes off. So doing the banded medial and lateral distractions I'm gonna show you here help to increase that mobility, increase that control and strength of supination and pronation, which is absolutely vital for running. Also, you can see here, well, I don't know if you can or can't, I'm loading my glute as well, just to kind of get everything integrated, everything working in unison. That way it kind of translates well into my running. So if I can kind of teach my body to stabilize my hip, turn my glutes on while my foot is controlling supination and pronation, that's ideal for running efficiency and reducing your injury rate. And again, improving your efficiency. So I'm really loading the glute, especially on that medial distraction when it's kind of, the band is pulling me inward, my lateral hip rotators and my glutes are really turning on, and you want to feel that glute working as well. Squeeze your glute on that stance leg as you drive up and hold that balance. Next, I'm going to show you guys the BAPS board. The BAPS board is great because it gets all those intrinsic muscles, those small muscles of your foot working. Get your calf muscles working all the way up to the hip and the glute. I'll rock forward and backward on this, just controlled. I'll do some kickouts to the side, kind of get the hips stabilizing as well. And I'll do about 10 reps of each of these. You can get both legs, and again, this shouldn't take you any more than 3 to 5 minutes. I like to do this at least once a day, but you can go up to twice a day, and just really get that stability of the foot. And let me know if this helps you. This should help to reduce your injury rate, improve your efficiency. I've been able to go from a 3:15 marathon, and most recently ran a 2:32 marathon in Boston of 2026. So again, I'm a physical therapist, I'm a marathon runner, and I'm here to help. So let me know what you guys want to see next, and I will see you on the next one.